Hello, and thank you for joining us for today's Great Challenges live event, part of the Great Challenges program, sponsored by the Robert Wood Johnson Foundation. I'm Stacy Liu, and I'll be moderating today's discussion. I'm a freelance health journalist, and I'm the blog editor for TEDMED.com. I was also a full-time caregiver, which is an important factor in this discussion, as you'll see. The goal of the Great Challenges program is to look at the most complex issues in health and medicine, problems that have multiple causes and can't be solved overnight. Today we will explore how problems we don't like to talk about in the workplace, like caregiving, marital and financial problems, and chaos at home, we're calling them unmentionables, can affect our health. It turns out that these life issues may be able to predict health problems. And this is a problem and a finding that's getting a lot of attention from employers and insurers. We're taking questions from viewers on social media. We're on Twitter at TEDMED. Just tag your questions with the hashtag Great Challenges, and we'll do the best that we can to answer them in the hour that we have together. So first, I'd like to introduce our guest for today. Alan Blaustein is a Great Challenges team member and the founder of Care Planners. It's a support and guidance network for those managing the care of their aging loved ones. Alexandra Drain is a Great Challenges team member and the founder of ELIZA Corporation, a leading provider of integrated healthcare communication strategies and publisher of the Vulnerability Index, about which we're going to be talking today. Joan Kennedy focuses on consumer health engagement at Cigna, where she leads health advocacy, lifestyle management, and chronic condition programs, and other core programs at Cigna. Suzanne Mintz is the co-founder and CEO Emeritus of the Caregiver Action Network and consults on caregiver advocacy initiatives right here in Washington, D.C. Marianne Sterling is co-founder of Connected Health Resources and principal at Sterling Health IT Consulting, spearheading initiatives to improve how patients and caregivers navigate the healthcare system. Welcome all of you, and thank you for joining our conversation today. First, a bit of background. ELIZA Corporation of Danvers, Massachusetts specializes in health engagement management. They developed the Vulnerability Index to help insurers and employers measure how life issues like caregiving, financial troubles, or marital problems impact our health. According to their research, these vulnerability factors make people much more susceptible to chronic illnesses like mental illness, lower back pain, and diabetes. The company says the Vulnerability Index has 3 times the predictive power of self-reported health problems than traditional measures. Caregiving shows a particularly strong link. Caregiving employees are nearly 3 times more likely to be highly vulnerable to health issues than non-caregivers. The problem is, employees don't like to talk about these issues, which is why ELIZA Corporation calls them the unmentionables, and that's a term you're going to be hearing a lot today. So I would first like to ask Alex Drain of ELIZA Corporation to walk us through the project. Alex, can you tell us a bit more about the Vulnerability Index? How did it come about, and how does it work?
Absolutely. I want to start by saying thank you so much for having all of us. It's a great honor to be here with you and with the rest of the folks. I'm a great fan of everybody who's part of this. So thank you very much for including us. And I want to quickly address the first thing you said. We're actually finding that it's really employers who've been more skittish about talking about these things. Real people talk about them all the time. In fact, they're the things around which, for the most part, their lives revolve. So quickly, in terms of background, the hypothesis really that drives the notion of the Vulnerability Index is that maybe the biggest diseases in the U.S. are not just the things that we usually focus on, things like diabetes or heart failure, but actually include life challenges, things like being a caregiver or financial stress or relationship stress. And we came to this after over 1 billion interactions with real people, where our job on behalf of big health plans or employers was to reach out and talk to folks and encourage them to take better care of themselves, go to the doctor, get a mammogram, take care of their diabetes. And what we heard from folks who would very lovingly say, I can't do that right now, we would ask the follow-up question, why not? And very rarely would somebody say, because I don't believe in it, because I don't care about it, I don't think mammograms matter, or I don't care about my diabetes. Not at all. What they would say instead is, I just can't prioritize it right now. My husband just lost his job, or I'm caring for an aging parent, or I'm going through a divorce. And so this sort of stuck in our craw, and we thought, well, maybe these are the real challenges. Maybe life conditions impact health. And so we started a research and analysis initiative. We called it the unmentionables because of this realization we had that the healthcare system overall just didn't seem to want to talk about this stuff because maybe it wasn't traditional, but that it seemed to be so central in the lives of the people that we were trying to influence. So we did a lot of work to sort of identify what were the largest factors, and ultimately came to a place in conjunction with Wendy Lynch from Altarum. They were wonderful in helping to legitimize the research that we were doing and brought a lot of extra perspective to bear, that we could measure these things through an algorithm that we called the Vulnerability Index that's made up of three main components. One is the presence and magnitude of these life challenges. And currently the Vulnerability Index addresses three life challenges: being a caregiver, financial stress, and relationship stress. But those things don't operate in isolation. When life challenges happen to you, how much they impact you from a health perspective is very dependent upon your personal store of coping mechanisms. It's the best way to talk about it. And we identified in the literature and in our own work three main positive coping factors that we call the buffer. These are a strong network of peers, a strong sense of spirituality or being able to calm yourself, as well as exercise, believe it or not. And then magnifiers, which are negative coping factors. And so when a life challenge happens, if you have a lot of these magnifiers, which are trouble sleeping, being sad or worried, or substance use, this is not substance abuse, this is not a bottle of wine before breakfast, it's 3 glasses or 4 glasses of wine instead of 1, that in fact the measurement of those things ultimately we learned was very associated, as we would all expect if we just think about our own lives, in fact, to how health is experienced. Specifically, individuals who are highly vulnerable are close to 2 times as likely to have immunity issues. They're close to 2.6 times as likely to have diabetes, 2.9 times as likely to have back pain, 5 times as likely to have mental health. They're about 5 times as more expensive, 4 times more likely to be in the top 5%. They're much more heavy utilizers of things like inpatient admissions. And most importantly, what we found, because I think obviously cost and disease matters, but what we're all trying to do as humans is connect to and support humans. And what we found is not only are people very eager to answer these questions, close to 90% finish answering the 9 questions that are currently in it, but it's heavily associated with satisfaction. The very act of asking someone about these things that are so critical when they're happening to you, in and of itself, made people feel better about the brand and about the situation. And what's been amazing for us is we get to work with partners like Joan Kennedy at Cigna, who says, that's great that you're measuring this. I get this in my gut. I agree with you. What are we going to do about it? And I think we've had just an amazing experience helping to sort of explore what resources do exist and what can we as a healthcare system do to not just broaden our definition of health, but actually broaden the resources that we bring to bear to support people when life doesn't go the way that we always wish it would.
Thank you, Alex. Joan, can you tell us, apparently Cigna has this pilot program with the Vulnerability Index, as Alex mentioned. How's it going? What have you been doing to work with the index, and what kind of response have you had so far?
Well, as Alex said, we talked about the kind of life stresses that people have, and started to look at what we were doing at Cigna and said, well, is there a way for us to put sort of your life issues and your health issues together? Because focusing just on health or focusing just on finances or stress really doesn't get at the whole person. And so what we did is took the Vulnerability Index and the idea of taking our intervention programs and marrying them together, went out to our clients and said, would anyone be interested in piloting these programs and see if we can actually affect improved life health? And we got overwhelming support, so we are now working with 3 partner clients on using the vulnerability index to assess sort of the people's level of vulnerability, and from there, folks that are vulnerable, going ahead and putting together a comprehensive set of programs to really address those issues, and really looking at how to reverse engineer some of the programs that we do today. So, for example, a lot of times we'll start with a chronic program front end of a program that we'll be working with somebody on, but really what we should be doing is using their EAP benefits and helping them with stress and financial issues, caregiving stress, and those kinds of programs that most people have, but they think of them as being sort of stigmatized because it could be around substance abuse or work issues and are usually sent to EAP. Really, we've got to transform that into something different, because EAP really does help with a lot of these life issues. And so we reverse engineer a lot of our products and brought forth a lot of the lifestyle and sort of life issue programs through EAP, disability, and other areas, and started to address the vulnerability issues first, and then from there went into sort of helping them on health. And we've seen very good results. We're still in our first pilot phase. We're starting into phase 2 on lessons learned, but it's been an amazing experience.
Thank you, Joan. Alan, apparently you also are doing a pilot program with the Vulnerability Index. Can you talk about that and how the reception to that has been?
Sure. From our standpoint, I run a company named Care Planners, and we're a nationwide network of caregiver advisors that helps families through the activities of caregiving, from the standpoint of health and medical, to understanding the legal issues, the financial issues, the insurance issues. And where we focused our energies are on the adult children of the aging population. That's where we've seen the greatest need in the marketplace. The Vulnerability Index, and first I want to congratulate Alex on pulling it together, because it is a pivotal catalyst in moving the ball forward, and I'll explain how. When I speak with employers, and I speak with employers all the time, the folks within the Human Resources Department get the issues that we're speaking of. I don't think that they're unmentionables within the organizations themselves. The challenge for a Human Resources Department when they're trying to implement a program like this is to show how it impacts the bottom line and how they work their way through the Chief Financial Officer's office. And a CFO may be very cognizant of the issue, but without any type of quantifiable data to measure against, it's hard to get support for a pilot. So in the years past, there have been softer expenses used in some of these discussions. MetLife put out reports that on average, an employer was spending $2,500 a year per caregiver because of absenteeism and presenteeism. And those are great things, and everybody recognizes the issue, but it's almost impossible to measure them. So the brilliance of what Alex did here was she tied the expenditures to the caregiver themselves and the health issues of the caregiver, which result in greater expenditures on the part of the employer. So if you look through the Vulnerability Index, you will find that a caregiver, on average, costs an employer $4,000 more a year in direct health expenditures than a non-caregiver. And what that has given me in the service business that I'm in is incredible quantifiable ammunition to go into an employer and say, here are numbers that we can measure against. Our business can help you take this 4,000 number and decrease it significantly. And the result has been conversations going far further than they were prior to the Vulnerability Index. And we now have pilots ready to go with 2 of the Fortune 50 companies. And I believe during 2014, we will work hard to validate this. And once this is validated, the whole construct of caregiving gets a level of legitimacy that it hasn't been able to get to date.
Alan, I completely agree with what you're saying. I think the fact that Alex has been able to quantify these things that human beings constantly understand, of course, in their daily lives, but being able to put it into business terms that can be measured gives everybody the ammunition that they need. So I can see a huge leap forward in terms of recognition, in terms of not only employers, but health systems as well, like Cigna, who are understanding the ramifications of all of this. And so I think I see things moving ahead a whole lot faster than they have in the past, and that's just so exciting.
And I just want to jump in quickly. Thank you guys so much. I have to say, this is, you know, a broad group of people who are working on this, some of whom are right here with us. Thank you. And I am enormously grateful to Wendy Lynch and Altarim, too, and really the whole ELIZA team. And you guys right here on the bleeding edge of it. So thank you.
Thank you. Alex, you had mentioned to me before that
I'm not hearing her. Are you hearing her?
I'm not hearing you, Stacy.
Yeah,
Oh,
Stacy,
I'm
I'm not hearing you either.
Can you hear me now?
Yes.
Yes.
Okay. Alex, you had mentioned to me before that many employees don't actually realize the benefits that are available to them through the employee assistance programs. Certainly, once they get over the stigma of perhaps you know, going through the program, that's one hurdle. But the second one is they may not even realize that some of the benefits that are packaged in the employee assistance programs may actually be helpful to them in their marital issues or their caregiving issues. So I'm wondering, Mary Ann, could you talk a little bit to, in your view, if that has been an issue, and what could be done to help folks know that, hey, you know, their insurer is ready to reach out if only they're willing to ask for help.
Yeah, Stacy, I think a lot of people don't understand what services are available to them, and on the services side, I think these services sometimes fall short. In other words, you know, you may call a number, you may talk to a human being, but you may never get connected to the resources in your community that you need. Okay, so we have to connect the dots a little better between the needs of the caregiving community, their you know, their knowledge of what's available to them in the workplace, and then connecting the dots to resources in their own communities. Because without that connection, the employee assistance programs are of little use.
Thank you. Alan, could you add to that?
Absolutely. In my experience with the employee assistance programs, they very much want to help the employee base for whom they're dealing with. But they tend to be, as Mary Ann mentioned, limited in the resources that they can provide. And when it comes to caregiving, caregiving is not generally a linear activity. Caregiving involves a lot of different aspects. And when you're speaking with your employee assistance program, they can help you with some pieces of it, but I have found that they don't tend to be as sophisticated as necessary for the plethora of issues that you're dealing with. Again, when you're taking care of mom and dad, you're not just taking care of their health and medical issues. You're dealing with legal issues, financial issues, insurance issues, housing issues, and it's a whole journey. And I find that the employee assistance program is much better as a point of crisis management than it is an ongoing journey management.
Yeah, jump in really quickly on that. One of the things that Joan mentioned before that we see absolutely is the sort of sense of stigmatization that occurs with the branding of the concept of an EAP. And we have to be really careful of that whenever we're talking about bringing resources to bear. And I think when Joan talked about sort of reverse engineering the EAP to pull out of the whole its parts and connect an individual in need to those parts, that's key. Another thing I would add is people who are in need, and we've all experienced this, often lack the capacity to go out and look for help. So I think one of the things that's critical in any of these situations is most caregivers are not going to come rifle through your website or pick up the phone and battle through finding the right person. They're just going to sit at home and suffer. And so I think what's really important within the healthcare space is that we don't just acknowledge that these things exist. We don't just find the resources to connect people to, but we go out into the community and give people an opportunity to share that these things are happening. Because what we found is they will, and they're enormously grateful then to be connected to the resources that you guys are all talking about.
Well, and Alex, if I could add too that, you know, I think something that companies don't realize, most communities have, for instance, an area agency on aging. They can partner with that area agency on aging to bring the benefits of that organization to their employees. They can have someone from the area agency on aging come in and talk to their employees about caring for, say, their parents, and some of the services that they offer right there in their community. I think there are big opportunities here for employers to step out from behind the curtain and partner in their own communities.
One of the things that we're not really talking about, this is Suzanne, is that family caregivers are reluctant to identify themselves in the workplace. That because they don't know how individual managers are going to react. They don't know how their colleagues are going to react. And I think in order to really move this stuff along, the CEO, the C-suite, needs to make statements about how much they really believe in helping these families, that they're not going to lose their positions, that the company cares about them and knows that if they support the caregivers, it's going to help the company. But I fully believe it needs to come from the top.
Well, I think that's interesting because, as we were talking about when we went out to employers, and, we've got hundreds of them at Cigna, obviously, and we actually had to turn many away in the initial pilot phase 1. And so I think you're seeing folks really realizing at the top, these organizations that are partnering with us and the many more that want to join on, that they know that they need to address the larger issue of people's lives. And that's financial stress, it can be caregiving stress. So I feel from the people we're working with that they're very eager to do that and to create, I think, a better work environment, because they know somebody who is less stressed of whatever vulnerability it is going to have, better productivity and be better at work. And expanding that just from health to life is important and very, very top of mind for maybe not every organization by any means, but certainly there's a lot of them out there. And maybe we pull these pieces together, take these leading edge employers and work with them to bring this to the forefront, to provide this different model for the future.
I think that's great. There is, in the healthcare research community, a relatively new initiative around the concept of multiple chronic conditions. There is virtually no research on multiple chronic conditions because you can't really isolate the variables in the traditional way that you would if you're doing a study on diabetes or heart disease or any other specific diagnosis. And so there was recently a meeting that was led by NIH around this concept of multiple chronic conditions. And what came out of the meeting was the general acceptance, really, of what we're talking about, that people with chronic conditions are dealing not just with the disease, but with their whole life, with the community, with the healthcare system, with the school systems, etc. And that you can't really do the right research unless you take into effect these psychosocial issues, which traditionally have not been part of medical research. So there's a whole new awareness going on, and there's a paper that came out of the meeting, and hopefully we'll know soon whether it's actually being published.
Thank you, Suzanne. And you bring up an interesting point, the whole host of psychosocial issues. It seems that there's a certain sensitivity, perhaps, in talking about caregiving in the workplace as opposed to perhaps a person's own illness. For example, in my reporting on this topic, somebody mentioned to me, I couldn't talk about my mother-in-law's issues because I felt that it was an invasion of her privacy. And that it just, it was just sort of seen as sort of a downer topic as opposed to some other things. Can you comment to that, Alan? Do you think that caregiving makes it harder to connect the dots than some other life issues?
I think so, but it's interesting. It depends what kind of caregiving you're speaking of. I have found that, and again, our focus being a little bit on the aging population, that there's more understanding and more help available for you within your community when you're speaking of your spouse or your child. When you're speaking of dependents that are within the same household or within the same community, there seems to be a bonding that happens over those type of activities, and I do find that employees are more readily available to speak to their employer about it. The interesting thing is, I agree with you, the things about mom or dad or what Suzanne suggested in terms of somebody's mother-in-law, they don't get discussed at work, and I don't know exactly why. And maybe it's because people don't believe that with mom and dad living a little bit further away and being independent to them, that there's really support available in the workplace for that type of activity. Maybe because the way the insurance protocol basically works is that your employer is in a position to help you with you and your immediate dependents, and mom and dad don't fit into that category. I don't have the perfect answer for it, but in all the conversations that we've had with clients and others that have told us, many have said that they have not tried to go through their employer for help because they didn't think their employer was in a position to help them.
Alan, can I add to that? In my own experience, I found my previous employers to be, I'm self-employed now, but I found my previous employers to be very much more understanding about people missing work due to child care issues than they were about me missing work due to elder care issues. So there seemed to be a tolerance level there that was very different depending on who you were caring for, as you pointed out.
Yeah, I just want to add into, I think one of the other challenges with being a caregiver of an aging parent, which we all know with the silver tsunami coming through, is going to be more and more a reality for many of us. And not just being a caregiver of an aging parent, but at the same time, as part of the sandwich generation, caring for children, comes back again to, are these individuals who are in a place where they know how to ask for help? Because so many folks, when they're caregivers, aren't even aware of the hole that they've fallen into. And one of the number one biggest issues with being a caregiver is a sense of isolation. And associated with that sense of isolation is guilt. And the guilt comes from resentment, the resentment that you often feel towards the person you're caring for. And it's really hard to talk publicly about the fact that you're caring for your mom and you're mad, that you're exhausted, that this is hard. And so one of the number one most important things to do in that situation is to actually connect these caregivers to people like them. And the number one thing caregivers do for other caregivers is say right away, you are not alone. This is normal. You are experiencing what everyone else experiences, and you are a good person. And one of the movements that we want to start is really this sense that caregivers are the unsung heroes of the world, certainly of the United States, and what can we do to build pride and respect and sort of camaraderie and appreciation for this population into the backbone, certainly of the healthcare system, but really I would say to the country at large.
Alex, let me object to the word hero. Family caregivers are not heroes. They are people in perhaps extraordinary situations, but heroes are people who don't need help, in my estimation. Caregivers obviously need a great deal of help, and caregivers do need to feel respect and pride in what they're doing. The healthcare system certainly needs to acknowledge them, which it doesn't do at the moment. So we've got to watch out for putting people on a pedestal for doing things that really are becoming the norm. What we need to do is give people a tether. I mean, you were quite right when you were using the word isolation. But if people feel a connection to a human being who really can connect them, not a system, but an individual, a care manager, if you want to use that terminology, so that they feel that there's somebody there that they can call when there's a need. That's really what is needed. And I think there's an issue with community services because so many of them are public services. They are tied to finances. And the people in the middle, the people who earn too much money to qualify for public programs, are the ones who are really, really hurting. Obviously, if people have means, they can buy services. But it's the people in the middle who are really left out of all of this. And I think that the healthcare system is where it really comes together. We are paying lip service, at least at this point, to the concept of patient and family-centered care, which by definition is holistic. But we haven't actually moved it forward yet. One of the things that I am really involved with is the concept of identifying family caregivers on medical records. And the idea is that we really don't exist anywhere. Babies are born and they get a birth certificate, but family caregivers are not noted anywhere. And so it's hard to engage with someone who you don't acknowledge as existing. And all of the data that Alex has, which is what's so extraordinary, can be used as part of the indicators of, A, what's this family caregiver doing? Are they capable of doing it? And also, what is its impact on them? And that's my hot button at the moment and something that I'm working on. And but I think until we pass that threshold of actually identifying family caregivers, and it's through the healthcare system, if people aren't chronically ill or disabled or dealing with aging issues, they don't need all of this stuff. Nobody is a caregiver. So I do think it starts with the healthcare community as the place where we all begin that journey.
You raised a very good point, Suzanne, about community assistance and reaching out and saying, I'm not alone. I'm wondering, we did get a question from Facebook about how does this work for people who work remotely, for example, who might not even get face-to-face with their boss or their colleagues to discuss these issues. I'm wondering if Marianne could speak to how perhaps web-based technologies are helping caregivers and other folks with life issues to come together, not just in their office, but in their community.
Sure. We're actually working to connect caregivers to the community. My organization's working on that through a combination of people, process, and technology. The technology piece is the simple part, because we now have the ability through everything from patient portals and mobile apps to connect technically. It's the people and process that we don't do well at all in the healthcare system. And we need to recognize that, first of all, caregivers are the most underutilized resource in healthcare. We can be very key members of that patient's care team if we're included in the conversation. But as Suzanne alluded to, we're not really in the conversation yet. But through technology and through some people and process changes to our healthcare system, we can be.
Question, though, also of privacy. We're getting a lot of questions from Twitter and Facebook, and I just wanted to field one of them. Barry Zamba asked via Facebook, how do we promote a culture change showing the value of sharing these issues with each other? For example, look at Penn State, where the faculty members were unhappy that they were asked to answer a health questionnaire about marital issues and other stressors. That sort of conflicts with what you said, Alex, about how being surveyed in the workplace brings very positive feedback. Well, so I'm wondering if there's a way that we can sort of mesh these two issues together.
I'm so glad you asked that question, because, you know, this has been an issue in the healthcare space for a really long time. And one of the things that we say at Elias is how you ask a question can feel like a statement. And I think one of the issues with that situation at Penn is very, very specific, which is individuals were asked to answer a series of questions. They were told if they didn't answer them, they were going to lose money, and they weren't told what the value was of answering those questions. And I think the reason that we've had the success that we have when we reach out to people is it's voluntary for them to do it, and the entire ecosystem that's wrapped around the process starts with this one incredibly important factor that is missing in a lot of the healthcare space, which is empathy. What we're reaching out to people and saying is, we get it. Life can be really, really hard. And when it's hard, you could use some support. So instead of lecturing you about the fact that you're not exercising enough or your blood pressure is high, we're going to flip it and come and try and understand what is going on for you. Then we're going to hold your hand and we're going to walk you over to the place where the resources that exist that can help you. And when we do that, and we do it in a way that is unbelievably secure and HIPAA, everything is being honored about the individual's privacy, and make everything be the choice of the individual to share and the choice of the individual to access these resources, we get an unbelievable response.
Alan, you have something to say about that?
Yeah, just to add to Alex's point, I think the whole idea of privacy and questions being asked is the answer being used for the questioner, or is the answer being used for the individual? If the individual feels that the answer is being used for themselves, then issues of privacy, while they don't fall away in any way, shape, or form, people understand it. I was a cancer patient and spent 2 or some years in a hospital bed. I can guarantee to you that when my roommates in those hospitals were speaking with their doctor, and the doctor had a little bit more information than the patient remembers asking them, there's not a single patient that then turned and said, how did you get that information? Within context, if the information is being used for the individual being addressed, and privacy, which is taken on a very scary term, as opposed to just understanding how the information is going to be used, in context, I think that you can work through it.
You know what? Something we haven't really discussed is the idea, the need for hands-on help. Which is what so many family caregivers who are doing the heavy-duty caregiving really need. I mean, it's one thing to be connected to an area agency on aging to find out about Meals on Wheels for your mom, but doing the hard physical work of caregiving is something that really just comes down to the caregiver, and it is not something that is paid for at all by insurance. It's all out-of-pocket expenditures. And that, in so many ways, more than anything else, is what's going to relieve the difficulty of family caregiving, both in terms of always being on call and just the physical work of it and the emotional issues that come attached. 46% of family caregivers are doing medical tasks these days. If you're doing medical tasks, you're really dealing with somebody who needs a great deal of help. And I think it's important that we segment what we mean when we're talking about the caregiving population.
That brings up a very interesting issue, Suzanne, and I want to go back to what Alan said earlier. Per your comment, there's a $4,000 difference in the health costs of caregivers versus non-caregivers. Let's unpack this a little bit. Is it because of, do we think, the direct effects of stress on our health systems, or is it because we do not engage in preventive health for ourselves, for example?
It's actually both. Stacy. There were some studies done a while back at the University of San Francisco with a population of parents of kids with special needs. And they used that population because they figured it was perhaps the most stressed population out there. And what these researchers were measuring was the impact of stress. And what they found from a clinical standpoint was that the telomeres in your fingers do not regenerate nearly as quickly when you're under extreme stress. And so family caregivers in these situations can age up to 10 years prematurely.
Joe, can you speak to that? What has your experience shown in terms of what some of the underlying issues might be? And we also have the question, what have shown to be some of the most effective, low-hanging fruit, if you will, towards getting employees to improve their preventive health care services to themselves?
I'm sorry, was that question addressed to me?
Oh, no, it's Joan. Can you hear me?
Yes, I can hear you.
Oh, okay. I'm just wondering if you can speak to what in your experience seems to be very closely related, you know, in sort of translating, where do we get to step A, where the vulnerability index has this predictive power, and B, we have these health results. What's in the middle there? Is it lack of preventive care? Is it direct problems with stress, like physically making us ill? What's your opinion on that?
Well, it's interesting because I think we started, 20 years ago really going at the health issues and trying to work with preventive health and manage that effectively. And I think what we're seeing is that you really can't separate the whole person, and that if somebody is going through immense stress, whether it's caregiving or divorce or financial stress, the aspects of your preventive health and personal lives are going to take a back seat to that stress. And so I think what we're trying to do is to work on relieving some of those activities that are stressing individuals so that they can start to focus on their health. We sat at an executive leadership meeting, and our CEO said, there's this friend of theirs sitting in their house talking about how they're relocating and they've got immense issues with the children as a result of that, and so I gained 20 pounds and I'm trying to manage it, but my doctor's telling me to lose weight, but I'm really worried about my life first, so I'm not really going to focus on my weight. So I think it's not as simple, I think it's a little more complicated, and we've got to take the whole person and try to deal with the stress and the health issues in conjunction, because trying to do one over the other has not worked to date.
Right, and the stress causes health issues. We know this. Family caregivers are far more likely to suffer from depression. Spouses 6 times as much, and children of aging parents twice as much. I know I've been there. I know what it's like to have major depression, and it's from the stress, and it's not just caregiving stress, because when you're a caregiver, there are all these other things that are going on as well. Again, we can't isolate different pieces of people.
Mm-hmm. We have a question that came in. What is the role for nurses and nursing in this system? Does it shift? And I'd like Mary Ann to talk about that.
Sure, Stacy. So, nurses are key in the culture change that we're going to need to make the family caregiver recognized as, a key person involved in a patient's outcome. My mom's actually a retired RN, so I know this one personally. The nursing staff, these are the folks that are actually, they spend the most time with a patient, especially in acute care, of course. So we really need to equip our nurses from nursing school, from the very start, with the tools that they're going to need to help us implement this kind of culture change.
Here's a question that we got from Becky on Facebook. Why don't employers and insurers simply cover marriage counseling, infertility, adoption leave? For example, I have alopecia, a condition that involves losing my hair. It's a very, very sensitive topic, and my insurer doesn't cover wigs, and this is directly causing my stress. And I'm wondering, Joan, if you could talk to that a little bit.
Sure. So there's a number of different aspects of what Becky's asking in her Facebook question, but I think this, first and foremost, as sort of an umbrella, when health plans are executing benefit plans, it's built off of the employer's design, right? So an employer will choose a selection of benefits, and that'll be a combination of state and federal mandated benefits like Family Medical Leave Act, as well as choices that they make in that benefit plan. So when you talk about adoption and those aspects of what Becky's asking about, certainly those would be covered under her Family Medical Leave Act, and she can work with her human resource point person to really work on how she can have the great time to take care of her new child. If the adoption goes well, that would be great. I think as you talk about some of the infertility or some of the marital counseling pieces, infertility is a benefit that she'd have to check with her employer. That's one that there's more choice about whether they fully cover, partially cover, or do not cover. So she would really want to understand that decision of her employer benefit. The pieces around the stress management, though, and I think around the marital advice, that gets back into the discussions of how do you get into a community, finding good counselors. And while I agree with the panel that EAP may not be the best place, it is a starting place for a lot of people who maybe don't know how to engage in their community or to find a psychologist or somebody to work with on those areas. So I would recommend that she look into her EAP benefit, and that may guide her to somebody that might be a better choice, but at least it gets her started. On the wig issue, which is clearly something that's very personal and it will bring her great joy in the unfortunate situation that she has medically, I think again that gets into sort of what your employers will cover, and I'm not sure if her benefit plan covers that or not, but she would want to check. If not, certainly if you've got a health spending account or many of the consumer-directed products that are now the base of her benefit plan, she can actually keep money out of her plan tax-free, and so at least it's a little bit better than having to pay full price, but that would be my recommendation.
Stacy, I'd like to jump in here too and say that our country has a changing demographic right now. We talk about the silver tsunami. We even have a moniker for it now, right? I think employers and payers as well need to really take a good hard look at this changing demographic and benefits, for example, that employers are offering need to catch up. If there are 4 out of 10 people that are family caregivers now, then that sort of benefit, allowing people time and pointing them to resources in the community to allow them to care for their aging parents. Employers need to catch up with this now, and payers as well.
I'm sorry, Suzanne.
I was just going to say, most people don't work for large corporations.
Sure.
And yet it's the large corporations that are most able to offer innovative packages of benefits, whether it's flexible work schedules or flexible workplaces or emergency home care, whatever. But most people are not in those environments. And so we need to think about people who are working in much smaller environments as well. And I think one of the things that I always have to step back from is that whenever there are discussions like this, we need to recognize that there are so many people in the country who are not like us. They're not well educated. They're not comfortable financially. They're living from hand to mouth. And that's a very different population. And the way that we meet the needs of people like that is also needs to be different.
Something you wanted to say?
I actually had a point that I wanted to add to this too. It's not only demographics that are the shifting sands, but who's responsible for the healthcare dollars that they're spending. And I don't view the bigger employers as necessarily evil empires that have prevented this type of care or coverage. But I think as you look at the next 5-10 years out, you're going to start seeing individuals more responsible for the dollars that they are spending on healthcare. Granted, I don't think anybody's ready for that to happen, but that responsibility will shift, and Becky could create a cafeteria plan that allows herself to cover the 3 or 4 things that she wants to cover, but it's also going to require Becky to become far more sophisticated about the system that she's within, so she can make those decisions for herself in terms of how it plays through. I think what the bigger employers are trying to do is manage a population, and I think that you'll find that you'll start seeing leave adjust a little bit as the demographics of the marketplace adjust. And I think that health spending accounts will adjust as the demographics of the marketplace adjust. And I think that the employers are going to step up large or small to create innovative solutions is an incorrect read of the marketplace, and I think individuals are going to have to bear that responsibility, which is a big part of this.
Yeah, also speaking to individuals and changing demographics, one manager mentioned to me who had recently been a caregiver, now that I'm a caregiver, have been a caregiver, I will be much more sensitive to the needs of my employees going forward. And certainly with our changing demographics, that's an issue that we're going to be seeing a lot more of going forward. So once we've all been in that boat, as more and more of us will be, we certainly will be perhaps more on target to look for clues from each other. So we have a question here from Phil Wolf. What are the limits to scaling your vulnerability interventions to whole companies, patients' communities, or larger populations? Alex, you want to take that one?
Yeah, it's really interesting. I had a conversation with somebody yesterday who was talking about population health and how can we use tools like this on the front end to really increase the intimacy we have with individuals and what's really affecting them. And he talked specifically, he comes from an organization with a lot of resources, a large employer. And what he was saying was, in any one particular circumstance, I can sit down with an individual and I can help them through these things. If they're going through divorce, if they have financial stress, if they're a caregiver, if they can't sleep, I can knit together solutions and work with that person to help. What he said that he loved about this tool, in conjunction, I think, with the massive steps forward we're taking. I think Care Planners is looking at bringing humans to bear, but also a lot of online solutions. I know anyone who's been to the Cigna GoU marketplace knows that a lot of the tools that they bring to bear to solve these, to bring solutions to individuals are online. They're apps. They're free. Or there are benefits that are covered by Cigna in collaboration with their customers. And so I think that the thing to remember is giving someone an opportunity to share that these things are true for them is infinitely scalable. What you then need to look at from a resource perspective is how do you connect those individuals who raise their hands and say, yes, these things are happening for me and I want help, to resources that exist. And those resources might be things that your organization already has covered through the EAP, or they might be things that are not. And in that case, you can go out into the universe at large, and a lot of stuff exists for free. So let's take the case of caregivers. I love that we're spending a lot of time on this because this is incredibly important. There are websites where you can plug in your zip code, and it's going to tell you the senior care centers that are in your area, or a social networking site where you can connect with people like you and learn that you're not terrible, that you feel this resentment towards the person that you're caring for. So I think the beautiful thing is by giving people an opportunity to share that these things are true for them, you can then go look at the sort of, in a world of limited resources, there are things that exist that are entirely free, all the way through to the high concierge type services that might be warranted in particular situations. So I think the scalability thing is a very addressable point, and I love that question was asked.
Mm-hmm. Joan, you had something you wanted to add.
Yeah, these are sort of a combination of what Alan's talking about and what Alex is talking about. I think one of the things that we have to remember, and I think it's going to be, to Alan's point, very shocking to America, is that we did legislate a new social contract. Whether you like Obamacare or not, who and how much you pay for your health care for every individual is going to change, whether you're getting it in the public exchange or you're looking at a new employer model, which will change as well. And I think one of the things to think about is in those environments, how do we help folks understand sort of the responsibility and accountability, but how do we also maybe bring different services to bear? So we talk to employers about there's the straight dental and medical and the things that you do today, but maybe it really is more of a retail environment where you can buy caregiving services, or you can have as part of your benefit plan alternative things, whether it's child care or whether it's caregiving or support, financial support that Cigna can offer in their financial services or life services. So I think there's also a different way to think about the future of health, the accountability of what people are going to want to buy and how they're going to buy, because they're going to be more front and center in that decision making and have more financial and more responsibility for those decisions going forward, which creates a brand new dynamic.
Thank you very much. Yes, Jane on Google Plus made the point that economic and health security lie underneath the stress we're talking about. She also adds, in this stalled economy, how can employers and employees work together to help people get more financially literate and realize we're all in the same boat? We have time for one person to weigh in on this. Marianne, do you want to take this? And then I have one final question for the group.
You know, lots of thoughts here, but you know, caregivers, you know, one of the stressors that we feel the most is the financial burden, right? And this is a tough one. I mean, a lot of people who know my personal story also know that my husband and I have spent about $250,000 on caregiving expenses out of our own pocket, okay? And I don't think as a nation we deal with this well at all. We don't even recognize what it's this particular impact on family caregivers. We haven't even begun to scratch the surface as far as you know, how do we address it? How do we get financial support to families? How do we even identify the costs that families are going to have to incur? We're not there yet. We have a much deeper conversation to have on this issue alone, and I look forward to that conversation.
Mm-hmm. Clearly, a lot of work needs to be done there. So we've got about 5 minutes left. I have one final question. I would like to, for each one of you to weigh in on it briefly. And it is, again, this manager whom I spoke with about this issue said, there's no way to start this conversation with my employees. There's no script. So I would like to ask each one of you, speaking to the employers and the insurers and the managers in our audience, of whom I'm sure there are many, what's one thing they can do to start to address this issue? Alan, let's start with you.
I thought I got to go last on this one.
Left to right, left to right.
No, you know, it's difficult. I don't know that there's one thing. I think being more sensitive to perceived distractions on the front end of the situation probably puts everybody in a better place to have a fuller conversation. But until it becomes a more comfortable conversation to have, I don't know how you necessarily do that. It's a bit of a catch-22 in terms of it. I know from my own standpoint that corporations and entities who are looking at it from a bottom line standpoint could use a little bit more estrogen in their system. And as the only guy on the panel, I'll tell you, I speak to most of the human resource managers who are women, and most of the CFOs who say no are men, and that's just the way it works out. So what can employers do? They can hire more women and demote the men.
Well, this guy was a dude, and he said that he was, you know, definitely going to be more sensitive to the issue. So we can only hope that will increase going forward. So, Alex, what about you? What's your one thing?
Well, my first one thing is I'm going to marry Alan, obviously.
Get in line.
Right, exactly. Number two, I think, you know, two things. They have to ask. And there was some incredible research that came out of Harvard a long time ago that as an industry we have to go back to and embrace it. And we saw this in the work that we did with Joan again, which is, you know, in sensitive situations, often people don't want to have that conversation face to face. They like the benefit of perceived anonymity. And this is where technology comes in. We don't have to sit across from you and ask you these personal questions. We can reach out to you through all sorts of mediums and give you a chance in the comfort of your own home or wherever you feel the most safe and secure to share this stuff about yourself. And I can tell you there are a lot of ways to ask these questions. There are a lot of ways to start this conversation, ways that feel really good, that make people feel supported, and ways that you can leverage technology to that end. So I would say, number one most important thing, you got to ask.
Thank you. Joan, how about you?
I think that there's sort of a combination of courage of the caregiving community and the receptiveness of employers. I mean, to your point, you're a caregiver now, and you're a lot more understanding of people that work for you that are caregivers, and knowing that the silver tsunami is coming, and probably all of us on, you know, my parents just moved to where I live this week for this exact reason. I think so many people are going to be caregivers, and I think if we create the conversation, understanding that many of us are all going to be in it who work in these companies and are going to be part of making this change. I think there's a lot more receptivity just because I work with employers every day, and this is a conversation we have with a number of them on a regular basis now. It's not the single off, one employer conversation. It is with many of them. So I think you need to talk and start to ask and have the conversations with human resources or your superior, and vice versa. I think that the employers will become more engaged and be more open to this, since so many people will be in this situation.
Thank you. Marianne, you want to add to that briefly?
Absolutely. Don't even ask. Get started. Why not start an initiative? If you're an employer, start an initiative. Don't ask. You already know that 4 out of 10 of your employees are caregivers. So, start with a small group, maybe at all levels of the organization. Start a program. Get a support group going for the caregivers in your organization, because you know they're there. Start the dialogue.
Excellent. Very good advice. And Suzanne? Oh, Suzanne, you're on mute. How's that? Suzanne? Okay. I'm sorry, Suzanne. We're gonna have to tap into your comments on our social pages because our time is up today. Unfortunately, I know. It's up for this hour, but we are not finished discussing this topic, not by a long shot. Clearly, there's a lot of work to be done. Please continue to share your comments on our community pages on Google Plus and Facebook, and join us on Twitter at #GreatChallenges. We're always open there. We need everyone's input to get to the bottom of this issue. Our next Google Hangout about the next generation of mHealth innovation will be on Thursday, October 24th at 2 p.m. Eastern. And I want to thank everyone in the TEDMED community, and to our guests who joined us today. Thank you very much for being here. And thank you again to the Robert Wood Johnson Foundation, sponsor of the Great Challenges program. Have a good day, everyone.
Thank you.